Hello, everybody. HB 3136 is a healthcare conscious refusal bill that grants individual providers and entire healthcare institutions the legal right to refuse any medical service that violates their moral, ethical, or religious belief. HB 3136 establishes not only the right to refuse care, but legal immunity for refusing care, including protection from lawsuits, professional discipline, or administrative penalties, whistleblower protections for employees who report violations, and no requirement that the provider refer the patient elsewhere. There is no oversight to determine whether the refusal is legitimate or discriminatory. An institution level refusal, meaning entire hospitals or clinics can deny categories of care. This creates a system where personal belief overrides patient needs. And the impact on LGBTQ plus people is horrific. Denial of gender affirming care, including hormones, puberty blockers, surgical aftercare, and even mental health support, is already heavily restricted in Oklahoma. HB 3136 adds another barrier by allowing pharmacists to refuse hormone prescriptions, hospitals to refuse gender affirming procedures, providers to refuse post operative care, and clinics to refuse referrals. Because the bill protects refusals based on any moral or religious belief, a provider can simply say, I don't believe in this, and face no consequences. There is denial of HIV related care. HIV prevention and treatment, especially PrEP and PEP, are often targeted by a moralistic stigma. HB 3136 allows providers to refuse PrEP prescriptions, PEP in emergency situations, unless EMTALA applies, HIV testing, and HIV treatment. This disproportionately harms LGBTQ people who already face higher barriers to HIV related care. Denial of mental health care. LGBTQ plus people rely heavily on mental health services due to discrimination, family rejection, trauma, and higher rates of depression and anxiety. HB 3136 allows therapists, counselors, and psychologists to refuse LGBTQ plus affirming therapy, gender identity support, crisis intervention, and suicide prevention counseling. A provider can legally refuse to treat a suicidal LGBTQ plus patient if they claim a moral objection, unless the situation qualifies as a narrowly defined emergency. Increased medical discrimination. HB 3136 normalizes discrimination by giving legal cover to biased providers, encouraging institutions to adopt discriminatory policies, making LGBTQ plus patients afraid to seek care, and reducing the number of affirming providers. This deepens existing disparities in health outcomes. Rural LGBTQ Oklahomans are hit hardest. In rural areas like much of southern Oklahoma, there may be only one clinic or pharmacy. Transportation options are limited, and affirming providers are rare. If the only provider refuses care, the patient has no alternatives. And then there's the impact on LGBTQ plus youth. Our youth, especially the trans youth, are uniquely vulnerable because they rely on adults to access care. They often cannot travel to alternate providers, and they already face high rates of mental health crisis. HB 3136 allows pediatricians to refuse LGBTQ plus related care, mental health providers to refuse counseling, hospitals to refuse gender affirming services, and school based health partners to refuse referrals. This isolates LGBTQ plus youth at an exact moment that they need the support most. And the impact on the adults: denial of reproductive care, denial of sexual health services, denial of domestic violence support, denial of fertility services, denial of partner related medical decisions. Because the bill protects institutions as well as individuals, entire hospital systems could adopt refusal policies. Then there's the cultural impact, legitimizing anti LGBTQ plus belief. HB 3136 sends a message that LGBTQ plus identity is morally objectable, that the health needs are optional, that providers may discriminate without consequence, and institutions may adopt anti LGBTQ plus policies. This increases stigma, harassment, and violence outside the healthcare system as well. Now, I'll go over a little bit about how HB 3136 affects everyone outside of the LGBTQ plus community. Reduced access to care for all patients. When providers can refuse care broadly, pregnant people may be denied miscarriage management. Patients may be denied contraception. Survivors of sexual assault may be denied emergency care. People with substance use disorders may be refused treatment. End of life care may be denied. The bill's language is not limited to LGBTQ plus related services. Providers who refuse care face no consequences, while providers who do offer comprehensive care may leave the state due to the hostile laws. This shrinks the healthcare workforce for everyone. Confusion and delays in emergencies. Patients may not know which hospitals or clinics will treat them. Delays caused by refusals can worsen outcomes for heart attacks, strokes, infections, and injuries. HB 3136 shifts power from patients to providers. Once belief-based refusal is normalized, any patient can be denied care for any reason. Legal and financial costs are also a concern. Malpractice complexity, insurance costs, litigation risks for patients, administrative burdens. These costs affect all Oklahomans. HB 3136 is framed as a provider rights bill, but its real effect is to legalize discrimination, reduce access to care, and endanger vulnerable populations. LGBTQ plus Oklahomans, especially transgender people, face the most direct harm, but the bill destabilizes healthcare for everyone in the state of Oklahoma.